Did you hear that Medicare Part D, the prescription drug plans, PDPs as some call them, that there's a new limit, upside limit as to how much you will pay out of pocket for your drugs in 2025? Yes, $2,000 is the new max that you will pay for your drugs, which is really low for some people. Others may not even realize that this was a thing. And of those, I bet you Tony Shore. Welcome to the show, Tony. I bet you had no idea because you're not on Medicare, but a
Well,
lot of my clients are, and a lot of the listeners
yeah,
are on Medicare.
my parents are.
Yeah.
So this will impact them because they both have Parkinson's and the medication is very expensive, and they are on a lot of meds. So with various ailments, so it does affect them, and it's a good thing. It's good news for them.
Yes. So you might be listening to this show saying, "Well, I'm not on Medicare yet. This doesn't apply to me." I think it does, and I'll get to that at the end. But basically, it's President Biden's effort to reduce the cost for drugs in this country, particularly for those on Medicare. There was the whole insulin thing. Remember that was a big push, and there was a reduction of the cost for insulin to like $35. And so part of the Inflation Reduction Act was to include this. And so January 2025, the cost of Medicare Part drugs is now capped. Well, how do you pay for drugs, by the way? For those that are unfamiliar or just want a quick refresher, there's 4 ways. You pay a premium to the insurance company to be on a drug plan. This has no impact on that. The premiums are what they are. You also pay deductible. Those are drug deductibles on these plans. You pay copays and coinsurance. Let me go quickly through those just so people understand what these are. Premium, Tony. Premium. This is the fixed amount you pay to the insurance company to have the plan. We just did a show on the cost for healthcare for people under 65 and
Right.
how ridiculously high it is.
Outrageous.
I would love for the government to address that or get out of the way of that. But I ranted on that saying that, it's subsidized. The only way to get cheap health insurance in this country is to get a subsidy from from the government or from your employer. And if you don't qualify for either of those, you're in trouble.
Yeah, but please put cheap in quotes.
Yeah, right.
It's still not going to be cheap.
Well, for Part D, the premiums, I think, are going to go up, but I'll get to that later. But the new rules do not impact directly the premium. I think they will. Then you pay a deductible. So there's a cap on the deductible, and that's $590 a year. So not every prescription drug plan has a deductible. Some do not have a deductible. Some might have less than $590, but the most that they can have is $590 for the year. And what this means is before the insurance company will pay for any of your drugs, you've got to hit your deductible. And there used to be no deductible cap on drugs. So there was no limit as to how much you could spend on drugs. So people would be spending a lot. They'd pay their deductible and then they'd still be paying, but they put some limits on it. So now a lot of the drug plans have deductibles where they didn't before. This is the insurance company's way of getting a little bit of money before they start putting anything out. Then you have copays, which everyone's familiar with. Okay, you go to the pharmacy or you get a mail order. You pay for the drug. That'll be $5. That'll be $25. Oh, if you fill it for 3 months instead of 1 month, we'll give you a discount. So these copays are now what the big cost is going to be for the drugs. And this is where between the deductible and the copay and the coinsurance, we're capped at $2,000 for the year. And then finally, coinsurance would be a percentage you pay at the drug at the pharmacy. So you might say it's a $25 copay, but eventually, remember the donut hole? Remember that whole thing?
Yeah.
I see you perked up.
Yeah. Donuts.
Donut holes are gone. So they used to be, you would pay a percentage of the drug. after a certain amount of time, even if catastrophic coverage after donut hole and so on and so forth, that's all gone. But there is still a coinsurance, which I'll get to in a second. But this is a percentage of the drug. You pay a certain percentage, and the pharmacy or the insurance company pays the rest, or the government pays part of it. And then that is also included in the $2,000 max out of pocket. So your premiums excluded from the 2,000. That's not included in the cap, but the deductible, the copay, and the coinsurance, all told, add up to $2,000 for the year. You're done paying for any of the drugs outside of your monthly premium.
But you're saying, Dan, that because they've lowered that deductible, that these companies, to get their money, the insurance companies are going to, and drug companies will raise the premium because that's not included in the deductible. So that's probably how they're going to make up. You're going to pay higher premiums for your drug plan, the drug plan premiums, or maybe higher. Well, no, the copay is included in the deductible, so that doesn't.
The copay is included in the max out of pocket. The copay is included in the 2,000 cap. The deductible is included in the cap. The coinsurance is included in the cap. But what is not included in the cap is the premium.
Yeah.
So there's a quick and easy way for them to say premiums are going up, but good news, so if someone was paying $4,000 over the course of the year for their drugs, and now they're only going to be $2,000, where's that other $2,000 going to go? Where's it going to come from?
Right.
The insurance companies just be like, we'll eat that. We'll eat that. No. I'm going to hold on.
They're never going to eat a cost.
Well, who's going to eat it then? The government or you and I?
Yeah, both.
Right. Or someone that's not on any drugs that still has to pay a high premium and never use it. Just like the Affordable Care Act. Who's paying for it? Well, I get mine for free. Why? Because the government subsidizes it. Well, so it's free. Well, who pays the government? You do. I do. We all do. The taxpayers. Anyway, there are 3 stages now in the drug plans. 2025. You have the donut hole's gone. Say goodbye. You have the deductible, which is plan specific. So each plan can have their own deductible. Again, $590 is the max. I'm going to see a lot of insurance companies. Deductible's $590. Whatever the max is, that's a deductible. That's what's going to happen. Then you have the initial coverage phase, which you pay 25% of the drug. That's the coinsurance.
Right.
And that's going to be capped at $2,000. Some drugs, how the tiers, tier 1, tier 2, tier 3, generic, brand, all these tiers. Is there a copay? Is it $5? Is it free for the maintenance drugs? Or do I pay 25%? And so that is where most of the people on, especially these expensive drugs, get crushed. Is you got to pay half the drug cost. Now you're paying 25% up to $2,000. So someone can max out what they pay in the first month if they're on a really expensive drug, which does exist. There are drugs that cost thousands a month.
Oh, trust me, I know.
Right?
Yep.
And then the third is the catastrophic phase, where it used to be when you're in a catastrophic phase, you pay 5% of the drug, or that's gone. So there is a catastrophic phase, but you don't pay anymore for anything. So you've hit 2,000. Now you're in a catastrophic phase. You don't pay. You pay your premium. You don't pay for the drugs anymore. So this sounds great. Like I said, there will be a lot of people that benefit from it that are paying a lot for drugs. But what's going to happen? Premiums are going to go up. They already have. People in 2025 saw their premiums go up. They got the letter, annual nut letter during December 7th, October 15th to December 7th. They said, oh, your premium's going up. So you got to shop around. Mm-hmm. And you know what else is going to happen, Tony? You're going to, I'm not saying this is cynical me. You're going to see drugs not appearing in the formulary anymore. Because if it's in the formulary, the insurance, the formulary is the list of drugs covered by each company. Each company has their own formulary. So they vary from plan to plan. Now, there's some requirements by the government. The Medicare, CMS, Center for Medicare and Medicaid, says you have to have this in the formulary. But there is some discretion. So you'll see insurance companies like, I don't want that. I'm not covering that drug. If I'm an insurance company and I have to limit $2,000 from that payer
Mhm.
being covered, I know, all right, why would I ever want to include a drug that's going to cost $20K over the course of the year when I'm only going to get 2,000 from this, beneficiary? Yeah, the government's going to chip in some of it, but I'm going to have to eat that. Why would I even include that in the formulary? Unless someone mandates that I include it. And so you're going to see some pressure on these insurance companies to cut corners on what they cover. Mark my words.
Hmm. Yeah, they're gonna make us pay one way or the other.
Right.
Yeah, the cap is great news, but it is amazing how the insurance companies find a way.
And the government's going to pay. And who?
Yeah,
It's like
but
it's not like
which is
it's not
us, because
it's not like all of a sudden the drug companies are going to be like, guess what? We're only going to make 2,000 a year on any drug. That's the new rule. That's the new normal. No, they're still going to charge their astronomical rates. It's just who's paying for it, the end user or the government or the insurance company or
Right.
what? It's going to be the government. And who pays the government? Higher taxes or higher premiums for everybody because there's no cap on premiums. What's to say you won't be paying $500 a month for a drug plan? Well, I wouldn't pay $500 a month for a drug plan. Yeah, you would. If it covers all your drugs at 2,000 max, you might say that's worth $6,000 to me. I was paying $6,000 a month beforehand. So it's all shell game, in my opinion. Anyway, this is separate from low income subsidy. So that's different. A lot of people are on the low income subsidy already paying minimal for their drugs. This is not replacing that. This is basically adding more to it. This doesn't apply to Part B drugs. Here we go with the confusing letters.
Yeah.
Part A is usually hospitals. Part B is doctors, but you can have drugs in Part B. What that means is drugs that are administered by a medical professional at a facility. So if you get an injection for a drug at the doctor's office, that's not considered part of your Part D. That's considered Part B, which does not have the same $2,000 max out of pocket. Interesting way to help the end user is they could spread the payments throughout the year. So if you're on a bunch of drugs and you know you're going to max out at 2,000, you're going to hit that cap. You're excited about this program because you're going to be saving a ton of money. You could say, you know what? I'm going to pay my drug company, even though I'm going to be getting drugs throughout the year, and I'm going to hit that 2,000 in January because the expensive drugs are going to cap me out January, February. The insurance companies and the government's allowing you to pay equal portions of the 2,000 throughout the year. So you might pay $180 or whatever it is a month. So you spread out that burden. A lot of people, once they hit that donut hole, they used to then all of a sudden have to pay a whole bunch, and they're like, oh, geez, I didn't budget for that, or I can't budget for that. So this allows that, which is nice. Also, the late enrollment penalty still exists. So if you're listening saying, man, the premiums are going to go up, I'm not on any drugs, I'm not buying a drug plan. Why would I buy a drug plan if I'm not on any drugs? Why would I bother? I'm going to have to pay some premium just for what? To not use it, to subsidize other people? I get it. But here's the problem with that thought. One, there are some $0 drug plans out there. So you can get on a plan and not pay. You have to pay when you use the drugs, but if you're not on any, that's a good plan. But the other issue is the government's going to fine you, penalize you, late enrollment penalty, they call it. And that hasn't gone away. So if you don't get on a drug plan when you turn 65 or go on Medicare, if you don't get on one right away, the government keeps note of that. And then when you do get on a drug plan, if you do in the future, you pay a penalty, 1% for every month that you're not on it. So it can add up. That has not gone away.
Interesting. It gets so complicated, Medicare. And what's sad about that is that we're talking about seniors and a lot of people who just don't know what they don't know about this. And that's where you come in, I guess. This is something you help your clients with, right? If they have questions.
Right. Yeah, we have insurance company. So we deal with Medicare. That was like we always talk about, health insurance is a huge factor in retirement planning. And for a lot of people, it's the number one factor. Above and beyond, they can have millions in the bank. They just want to know about their health insurance because it's scary. and it's a big part of life. Right?
It's for a lot of people, it's their number one cost in retirement, and people think, well, I have Medicare. How could healthcare be my number one cost?
Right.
But taxes and healthcare are the two
Right.
biggies
And
in retirement, right?
And they go together,
Yeah.
because your taxes impact how much you get in subsidies. And now IRMA, which we talked about Aunt Irma in the past. No one likes her. You get a higher Medicare costs when you have more income. So yeah, I think it's important for people to realize that this is happening. A lot of people, I saw a survey, I forget where it was. A lot of the people on Medicare didn't even know that there's a new cap, and a lot of people don't shop their plans around every year. They should. And
during that annual enrollment period, the AEP,
right,
they should be shopping their plans.
They
right?
should be, but it's not too late. There's an open enrollment period, January, February, that you can switch your Part D plan if you forgot about it, didn't realize it. You can do that still. So it's never too late. Well, there are sometimes, usually after Valentine's Day, you can't switch. But again, you got to be on top of this. Don't get complacent, because what you're going to do is you're going to be paying $10 a month for your drug plan. And then the next year it's going to be 50. And you're going to be like, what happened? Why? Well, this is why. Because now there's a cap on how much you're paying. So they got to get the money from somewhere. So, Tony, conclude, the government changed the rules. This is part of the Inflation Reduction Act. Medicare drug plans were impacted tremendously. The price that people pay for drugs hasn't necessarily changed except for insulin, but the amount that they pay capped at $2,000 now is new and different. I think this has been phased in. Last year was $3,500 in 2024. So now it's $2,000. Will it stay there? I don't know. Let's see what happens. But a lot of people that have expensive drugs are applauding this. Hooray, hooray.
Yeah.
But people that weren't really using drug plans or didn't have to pay a lot, or just a general taxpayer, they don't feel it, but they will be soon realizing, wait a sec, money doesn't grow on trees. Someone's got to pay for this. And I think the fallout's going to be pretty severe, but we'll see, right?
Yeah.
Keep printing that money. Keep those printing presses going, Tony. As long as I don't pay a lot for my drugs, I'm happy, right? I'll just have to pay $40 for a gallon of milk, but hey, my drugs are cheap.
That's not true. That's not true. We do, but I mean, what are you going to do? Because they're trying to do something about the cost of healthcare and drugs prices in this country, because they are so much lower in other countries. It's just,
there's a lot of different ways to solve this problem. I'm not a fan of the government subsidies, but again, here we are.
Yeah.
The government's going to be subsidizing these drug plans, and it benefits people that are paying a lot for drugs, but at the expense of everyone else. So we'll see how it goes. I like to see people paying less for drugs. That's great. I don't know if this is the solution that I would have gone with, but it is what it is. And so let's deal with it. Let's be aware of it. And now you are, listener. Thanks for listening. Thanks for co-hosting, Tony. I hope you all have a wonderful week.
All matters discussed in today's show are for informational purposes only.
This show is not investment advice.
Dan Riddle nor Dolphin Financial Group are affiliated or endorsed by any government agency.
Investment advisory services are offered through Dolphin Wealth Management, Inc., a registered investment advisor in the state of Florida.
Insurance products and services are offered through Dolphin Insurance, Inc.
Dolphin Wealth Management, Inc. and Dolphin Insurance, Inc. are affiliated companies doing businesses as Dolphin Financial Group.
You should talk to someone at Dolphin Financial Group before implementing any of these strategies or ideas.